Immunizations is one of the most cost-effective public health interventions to date. With about 2 to 3 million deaths every year, there has been a great controversy around vaccinations in the recent years. It has been said that they cause autism and make children ill. However, these beliefs are invalid and lack proof. Vaccines protect children from harmful and even life-threatening diseases that have even saved more lives than any other medical intervention, including antibiotics or surgery. When parents choose to vaccinate their child, they put them at risk for disease such as hepatitis, HPV, measles, the flu, chickenpox, polio, and more. Also, not vaccinating their own child, they put their other children and others around them at risk for illnesses. Only 72% of children have had all the recommended vaccines, which means 1 out of 4 children are missing at least one. Even more concerning studies have shown that there are geographic clusters of unimmunized children, and within these clusters that vaccine preventable disease can sprout up and spread quickly. If these were to happen, not only children but also adults that are not immunized would be at risk for illness. Now that we have discussed problems, here is what can be done to prevent these illnesses. In order to increase vaccinations globally, there is a program being developed called the IA 2030, and their goals are designed to inspire action for implementation. For countries, this could mean setting country-specific targets and milestones for the decade towards those goals. For regions, this can mean contextualizing global goals and setting specific targets and milestones in regional vaccination action plans. For partner organizations, this can mean aligning organizational strategies and indicating to support an attainment of IA 2030 goals. To extend the benefits of vaccines to everyone, everywhere, is underpinned by 4 core principles. It puts people in the center, is led by the country, implemented through broad partnerships, and driven by data. The IA 2030 strategy systematically applies the core principles across each of the strategic priorities. Making sure that children have access to health care is the key to increasing the number of children who receive vaccinations. The easier that it is for families to access health care will make getting vaccinations easier for them as well. Some families live in areas where there isn't a doctor nearby, or they can't afford the visits or multiple vaccinations. One way to make access easier could be to have vaccinations available for children in schools. You could have a doctor that comes to school once a month or gives shots to children who need it for a small price. Although there's information about vaccines that can be easily accessible online, there should be more information in schools or even on social media. Now that we have discussed the possible solutions to increasing vaccinations among children, take the time to think about this. Remember how the world was in the 1900s when polio was around? Thousands of people died and suffered. 350,000 confirmed cases in 1988 to 33 cases in 2018, all due to vaccines. Vaccines have been one of the biggest success stories of modern medicine. Researchers estimate that 10 million deaths were prevented between 2010 and 2015, thanks to vaccinations delivered around the world. Here I have a picture. The red people are the unimmunized sick, and then the other blue people are healthy. Now, when you have 2 sick people and all the rest are unimmunized, this is what you get in result. Now, if you go down here and see, this is immunized people around 2 sick people, and you see it only spreads a very little. Now, here's what you could do. If you want to see the world without disease, you can be part of the change by staying informed about vaccines and informing those who have been maybe misformed. You could start by reporting social media posts that encourage vaccinations and even creating your own posts with facts. And now, or if you have your own children, get them vaccinated to ensure that they can remain healthy and safe. Hopefully after this presentation, I've convinced you that vaccines are extremely important for keeping children and everyone around them, and even you, safe. Thank you for listening.